Hi, my name is Josée Charlebois. I'm a social worker and the intake coordinator at the Ottawa Hospital Psychosocial Oncology program. I've been with the Psychosocial Oncology program since before we actually became a program. So about 10 years now, and a social worker at the Ottawa Hospital for 15. So I'm going to talk a little bit about what we provide in psychosocial oncology and some of the psychosocial aspect of being diagnosed with cancer and going through the treatments. So when you get diagnosed with cancer, there's no manual that comes with it. And that's often why people come to see us in psychosocial oncology. It's because they don't know where to go, what to do, where to start, and how to deal with some of the emotions that they may be facing when they first get diagnosed. And as treatments progress, there's often some questions and some emotions that come forward as well. And that's often we're there for the whole duration of treatments, and they come back to see us. It's not surprising that there's more and more research being done on how we can help patients face treatments, and that there's a benefit to dealing with the emotions as people go through their treatment period. So more and more we see some psychosocial oncology research being done, which we're quite happy about because we're in that field. In the last few years, we've talked about psychosocial support as being the sixth vital sign. And so there's more importance being put on dealing with the emotional aspect and the practical aspect of being diagnosed with cancer, which is a little bit of why psychosocial oncology was developed. And what it is a specialty in cancer care that's concerned with the whole person, not just the medical aspect of being diagnosed with cancer, but the emotional well-being, the spiritual, the quality of life, and the functional aspects of being diagnosed with cancer. Psychosocial oncology provides support from prevention through the end of life and bereavement. And again, it looks at the whole person. The history of psychosocial oncology. So we became a program in 2008. Before that, we only had a few social workers in the cancer center and a part-time dietitian. And in 2008, we got funding to become a program, and because of that, we hired a whole lot of different health professionals. And I'm going to talk a little bit about what we have in the program. But the goal of it was really to be part of the team, of the medical team. So we are located in the cancer center, and we do work a lot, very closely with the oncologist. So like Dr. Morash, Dr. Canil, Dr. Morgan, we talk to on a daily basis. We are supported through Cancer Care Ontario, which is our kind of governing body. And the focus is really patient-centered care for patients, family, and caregivers. The aim of the program is to provide support and rehab to the 21,000 patients that are seen in our cancer center every year. That number grows every year, and our staff doesn't necessarily grow with the number of new cancer patients, but we aim to serve everybody that has a need for our service. And not to say that not everyone would benefit from our service, but we try to offer support to those in distress or that have the highest needs. And then we also refer to our community partners like the foundation, and you'll hear about coaching, which we work very closely with as well. We provide services throughout the illness, so from diagnosis to end of life, like I mentioned. The PSOP, as we call it, provides services to patients that are registered with a cancer center, and to family members and caregivers as well. Because of our limited staff, we provide support 1 year post-treatment and for cancer-related issues. So a few years ago, we did a transformation project, and we talked to various patients and caregivers about what they wanted us to do and what they felt was going to be a benefit to them. And what came out was really a need for navigation through the healthcare system. advocacy and involvement of our PSOP program, communicating and informing them of what is to be expected throughout their journey with us, improving education and preparation, and then psychosocial support actually came out really loud and clear, which was quite nice to hear because we had been a program for many years by that point. What are some of the needs of our patients and families? So I'm sure you've had those questions as you were diagnosed as well. So they are wide and not necessarily always related to the cancer. But for those that work, it's where is my income going to come from if I can't work and I don't have private benefit? How am I going to pay for transportation? How am I going to get transportation if I don't have someone that can drive me to and from the cancer center? And as you know, if you have radiation, it's usually daily. And so if you're working or you don't have family or friends that can drive you, that can take a toll. And we need to find help. We need to help you find transportation to get through your treatments. Childcare, emotional support, all of those things are things that we deal with every day. So where we are. So our manager is Carolyn Andrews. We are located at the Irving Greenberg Family Cancer Center, which is on the grounds of the Queensway Carleton Hospital, and at the general campus where our main cancer center is. We do have social workers. I'm the intake coordinator. I'm also a social worker. We have psychiatrists, psychologists, social workers, registered dietitian, physiotherapist, and a speech and language pathologist. I have to look at my notes because I always forget someone, and I work with them every day, but I always forget a discipline. We also have social workers in the Ages Cancer Assessment Centers on the 7th floor of the Ottawa Hospital, not at the cancer center itself. But that's where a lot of our patients get diagnosed with either lung cancer, prostate cancer, and pancreatic as well sometimes. And we also have a social worker at the Breast Health Center located at the Civic campus. So there's many of us. We're a little bit all over the place, but we work very closely together. And we have a chance to meet usually every week as well to talk about some of the issues and concerns that we have, and also sometimes debrief on what we see kind of trends on if like there's a, for example, like this week we were talking about there's a new medication that is given to patients, and coverage for the medication is an issue. So we got a chance to talk together about what the process would be. So we try to always streamline our services so that we provide the same services. What we do. So from a social work perspective, we do a little bit of everything that is not actually providing chemo or radiation. So provide support to patients and families and caregivers. We are the only discipline that actually sees caregivers and significant others and children sometimes as well. We talk about the practical aspects, so those drives, the finances. So really, we do a little bit of everything, literally. There's no questions that we haven't dealt with. But we often also will liaise with the oncologist if there's questions around medication, around treatments, and do some advocacy as well with the oncologist. The psychologist will provide psychosocial assessments, intervention, therapy. So does the psychiatrist, and she'll often provide some medication and drug assessment and psychotherapy as well. We do have a psychiatrist at both campus. Our psychologist is only at the general campus, and the social work team is divided. So we do have a few social workers that go to the Irving Greenberg, but most of our social work group is at the general because that's where most of our patients are being seen. But we adapt depending on what the needs are, where they are, and that type of thing. Some of the comments from our patients, we did a recent survey of our patients to see what they had to say about our services and where we could improve. And most of the comments, as you can see, were very positive. And the comments were really around that it's an essential part of being treated for cancer. And that was really nice to hear because that's really why we're there. That's our whole reason for existing. And it's nice also to be able to bring that back to our senior management team and say, we are part of the team, and that's what our patients want as well. Our physiotherapist provides treatment that is cancer-related, so lymphedema treatment, mobility issues, that is directly related to surgery or to radiation and that type of thing. And her goal is really to maximize function and to do education and self-management. Our dietitians will provide nutritional assessments and counseling. Their main focus is really to get people through their treatment and be able to not lose too much weight while they're on treatment and that type of thing, and how to eat well while they're undergoing treatment. Our speech and language pathologist provides assessments mostly around swallowing difficulties, if that's related to your cancer as well. Some of the comments for those disciplines is, again, that it's very informative, that it helps, that it's directly related to their treatments, and that it often can be coordinated with doctor's appointments so that you don't have to do an extra visit to the cancer center, because we know parking is very expensive amongst other things, and finding drives to and from the cancer center is also difficult at times. Comments from our patients for physiotherapists is the same, very effective and, again, treatment related and very helpful. Anybody can access our program. We don't need a medical referral. I know for many services you do need your doctor to sign the form and send it in and all that. We don't need that in psychosocial oncology, so you can refer yourself if you're part of the cancer center. If you have been referred and seen an oncologist, you can self-refer. You have the numbers there. All of our services are covered through OHIP, and that's the benefit of us being part of the cancer center, is that we don't need to have extra billing and go through OHIP ourselves. We have funding that comes through OHIP, but it's part of your treatments at the cancer center. We also provide support groups and education sessions. So you have a little bit of those there. So we do have a nutrition class for those having treatments, breathe class for those with difficulty breathing or needing some education around that, lymphedema, and some financial. We've gone to and from doing some financial education as well, but we do it one-on-one, and at some point we are doing a group as well. And then we have a caregiver support group and coping with cancer stress. So the coping with cancer stress is a group that we have actually two groups in there. One for people that are newly diagnosed, and one for those that have been in treatment for a while, that have more advanced type of cancer, so that not everybody needs to hear. If you're newly diagnosed, you don't necessarily want to hear from someone that has more advanced type of cancer, so we can focus our interventions more towards the needs of the people that we actually see. And family members and caregivers are actually invited to come to the coping group as well, and to any of our education class. So it's not just the patient, but it's a whole family support as well. And then we have stepping stones, which is for breast cancer, so it doesn't really apply here. You may see, if you're going to the cancer center, we have a new look in our pamphlet, so it's just coming out. It's in printing right now and coming out, so you'll see that, and may actually be in our Facebook page at the Ottawa Hospital as well. So, and that's it for me. So I'll pass it on to Patricia, and then we'll be able to answer some questions.
Good afternoon. Are we doing okay after lunch and all of that? Hopefully I can keep you awake and not sleepy. I know that's my weak time for falling asleep. So my name is Patty Barrett-Robillard, and I am one of the cancer coaches at the Ottawa Regional Cancer Foundation. And I'm very happy to be here today, and also very appreciative that following me, Kip will be speaking, and I am very thankful for his time today and energy that he's giving us. So thank you for that, Kip. So the Ottawa Regional Cancer Foundation, and sorry, I guess I'm still waiting for my slides. There we go. And we'll go right to the next one then, if you don't mind. So the Ottawa Regional Cancer Foundation, we've been around for over 20 years, and we've been a voice for survivorship for all of those years. We've been a leader in our community in providing local residents with increased access to person-centered care. And you know, we've heard about that this morning, and that's sort of been a focus that has been important to our foundation for quite a long time. We started out actually solely as a fundraising organization, and that may be how some people have known of us before. When we started out, we wanted to provide funds so that people had the best possible outcomes for their cancer treatment. So we raised money for clinical trials and some of those things that you heard about this morning. For example, we raised funds for CyberKnife. We contributed funds for that. And when they were talking about immunotherapy, we have contributed money for immunotherapy. So our foundation still raises money because we want people to have the best possible outcomes for their cancer treatment. But what we realized as our foundation was progressing over the years was that when you experience cancer, it's not all about the treatment. It's not enough to just talk about the medications and the surgeries and that cancer impacts people in a much broader way, not just the person with cancer, but their family members too. And if you're going to provide them with the best possible outcomes, you need to address all of those issues. And that's some of the things that Josée was also sharing with you. So there was a real need for that. The other thing with our foundation is when we raise money and we focus on treatment, they are local. So we want people to have access to the best treatments in Ottawa so that you don't have to go to Toronto or the States or somewhere to get the treatment. So that's one of our goals too, is that people have access to the best treatment here in Ottawa. Next slide, please. So I'm here to talk about our cancer coaching program, which started about 6 years ago, and it was developed because of that recognition that if you're going to help people have the best outcomes from cancer care, you need to address the whole person and do things in a little bit different way. So a lot of work and research went into developing this program, and it's actually quite unique and something that we have in this area. In other parts of the country, you'll see other programs that are addressing some of the issues, but the cancer coaching program is a little bit different, and we're quite proud of the program we've developed. So cancer coaches are regulated health professionals. So we have a team that has a nursing background. My own background is as a nurse. I've been a nurse for many, many years, too many to say, but I've had a broad range of experience, a lot in the community. I've done some in the hospital, but working several years of working with people who are experiencing cancer in different ways, and for the last 4 years I've been working at the foundation as a cancer coach. And all of our team has experience in working with people in oncology. But some of us have a nursing background. We have a coach who has a social work background. We have a coach who has a nutrition, more exercise background, and we have a coach with a counseling nurse practitioner background. So we work together as a team, keeping each other up to date with research and resources and sharing information so that we can provide the best possible support for people who come to see us. So cancer coaching is available to at any point that you feel that you need it. So we often see people almost immediately, they get the diagnosis and they're just trying to figure out, oh my gosh, how do I deal with this? And they want help and information, and they're just in that shock phase. Sometimes we see them in the middle of treatment. Sometimes we don't see them till after treatment, and they're trying to figure out the new normal and trying to see, I'm done treatment, what does this mean for me now? Where do I go from here? I thought I would be okay now. So we see them wherever they need to be seen. Sometimes it's even a few years later. So it's available at any point in the process that you're going through. And again, without a medical referral. But it's also available for the person with cancer, but also for their family member. If their closest person is a friend, that can be their caregiver. So whoever is experiencing that cancer, whether it's the person themselves or the caregiver, they're welcome to come for cancer coaching. When you come for cancer coaching, again, there was talk this morning about that person, and the future of cancer care is being very person-centered, because we know that the best treatment is the one that is works best for you, because we are all unique. And we're all unique on a physical way, but we're also all unique on an emotional level. We all have unique support systems, different stressors going on in our lives, and so how this cancer is affecting you, or how it's affecting you as a caregiver, is very unique. So we very much focus on you as a person, and we'll work with you to help make the choices that are right for you, help you develop the skills that you need based on the skills that you already have. We call it that you're in the driver's seat. So it doesn't matter what your particular stage of cancer is, or where you're at in it. We're not going to say you should be doing this or you should be doing that. We'll hear your story and listen to you, and then see what matters to you, where you want to go with this. Next slide, please. So these are some of the successes we've had at the foundation and with our cancer coaching program in the last 6 years. We've served over 3,000 clients and their families. We also, I don't know if any of you have had a chance to be at our building. Our main center is on Alta Vista Drive, and it's a beautiful house. So we're a hub for a lot of different organizations to come. We want to be a meeting place where people who are touched by cancer can connect with others. So we've hosted in the last several years, the number I guess is 495 meetings, different cancer-specific groups. We've done education and research and sharing of information, so we've been a community hub. We're also working really hard to spread cancer coaching, because we want everyone who's touched by cancer to have access to a cancer coach. We're not there yet, but we're working hard on that. So we're doing some training of new coaches, and we are spreading cancer. We've done it for several years at our Maplesoft Center, but in the recent months we've expanded to have cancer coaching in Canada. We are out in Rockland, and we have one in Vanier. And soon there will be a coach at the Winchester Hospital, and with hospice care Ottawa also. So we're expanding slowly, and we have a dream of expanding even bigger. We also continue to be a foundation that raises money so that people in Ottawa have access to clinical trials and the best possible treatment. So we continue to do that at an average of $6 million a year that we give to better, improved cancer treatments. Next slide. So how coaching works, again, the starting point is what matters to you. So I know that I could see 3 men with prostate cancer in the same day, and what is keeping them awake at night, or what's their biggest stress, could be different for each of them. And so that's what is the starting point when we're doing coaching. What's the most important thing for you? Is it making that decision between surgery and radiation? And we often hear that. That's a hard one. Is it, how do I deal with the fatigue or the side effects of hormone therapy? Or is it, how do I deal with this change in role that I'm not able to work in the way that I was before, and I'm not, don't have the energy to keep up with my job, so I've had that loss and that grief of loss of work. So it really depends on what matters to the person in front of us, and that's where we start with our coaching. We work together. Again, it's a coaching model. So you may come with lots of issues, but what we're going to focus on with you is what are the ones you want to start working on? Because you may not be ready to work on everything. But what's the one that you actually want to take some steps? And that's where we'll work with you. We'll come up with goals, and we'll develop a plan. So we always say when people leave us, they have a plan to keep moving. The other thing that we do is we really look at barriers, because often people want to do things. They want to make changes, they want to deal with issues, but they don't maybe whittle down to what's stopping them from doing that, and what are the strategies to overcome that. We'll have clients say, okay, my doctor said I have to lose weight, so he told me I should start walking vigorously. And that's the end of the conversation. And yet they're not doing it, right? So what's stopping you from doing it? What things could you add in that might make it easier for you to do that? Or maybe, what's your goal? If the goal is to lose weight, maybe walking isn't for you, but maybe swimming is, or aquafit, or things like that. So it's looking at those barriers. If it's, I want to do radiation, but it means going to the hospital every day and I don't have a drive, what's the plan we can come up to help you get a drive? So again, it's looking at those barriers so you have a concrete plan. Okay. I'll take the next slide. So why does cancer coaching work? So there is actually more and more evidence that using a coaching model is actually quite effective and helps people make changes in a way that doing other things doesn't. The reason is that we see clients as the experts in themselves, rather than us as an expert saying, oh, this is what you're dealing with, here's some things you should do. It's knowing that you are the expert in yourself and in what's going on in your life and the resources you already have, and know your own needs, and based on that will help you develop a plan to move forward on whatever it is you need to work on. And again, as I said before, we'll talk about, well, what are those barriers? What's stopping you from doing it? What do you need to put into place so that you can actually move forward with it? And addressing those barriers, we see that there's an increased likelihood that people will move forward, that you'll take action. People tend to have a better sense of control and feel more confident that this is something that they can do. Again, they feel more empowered and able to take charge of their lives. And what we're seeing, and we collect data on this, is that they feel an improved quality of life when they've gone through cancer coaching. Okay, next slide. These are some, we do collect data and surveys every year, and so these are our latest ones that we've put together. But for the people that have gone through cancer coaching, 97% feel that they are better able to cope with their lives. They feel more confident that they can do something about their cancer or their well-being. Their quality of life has improved. They feel more connected to a cancer care team, and 93% rated cancer coaching as excellent or good. So we're getting good results, and what we're hearing from our clients is that cancer coaching is beneficial to them. So in terms of working with people with prostate cancer, these are some of the things that we have worked on with people with prostate cancer since we've been doing this. So again, that big one, decision making, whether to have surgery or treat with radiation, that's one we hear a lot, because as you heard even today, there's not a clear-cut answer to that one. So again, it's that decision making, what one's best for me? Living with active surveillance, as you've also heard, and I had a client in my office this week about that one, you know. The research is saying active surveillance is a really good choice. But it's not easy to live with active surveillance. And so how do you live with that? How do you manage the fears and stress? Coping with side effects, and they talked about those. The side effects from the treatments for prostate cancer can be very challenging. So, incontinence, erectile dysfunction, that lack of desire, and the fatigue and those things people experience from hormone changes, those can be difficult. And so your coach can help you come up with a plan to have better quality of life while you're dealing with those side effects. We also talk to people about making decisions around genetic testing. Again, some of those practical issues, return to work and finances. We can work with people about how has cancer, and particularly prostate cancer, changed your relationships. Because we know that it has a huge impact. Cancer in general has a big impact on your relationships with your family, but also your intimate relationships, and how that works. And that can be something that's often not talked about or is very difficult to talk about. Your coaches are very comfortable to talk about anything you want to bring up. It's a safe place, and we are able to sort of look at strategies or ways that you can work on that. Again, the coping with the emotions, anger, decreased self-esteem, depression, fear of recurrence, all of these are actually quite normal responses to having cancer. The emotional piece and the distress people feel is actually a normal response to having cancer, because it's very difficult. And some of the things that you deal with when you have prostate cancer are particularly difficult. Making lifestyle changes, a lot of times cancer is a wake-up call. People want to start exercising, improve their nutrition. We can work on that. And we also provide, as I mentioned, support to caregivers. And sometimes the only one that comes in is the caregiver, the person with prostate cancer. Again, the fact that it's a male cancer, it can be harder to get men in the door. We would love to increase that number. So, but often what we see is a caregiver, and that's great too. We are happy to have you. Next slide. So what we offer in terms of cancer coaching, again, we're a fundraising organization, so we have been fundraised to offer 5 hours of one-on-one cancer coaching for each person that registers. So if it's the person with cancer, they get 5 hours. If it's their caregiver, they get 5 hours. That coaching one-on-one is complimentary. And it's really based on your needs, how you use that, but we expect that you'll use it over about the course of a year. For some people, they have a lot of needs right away, and we might see you fairly quickly, and then maybe not for a couple months down the road. For other people, we might do a visit, set some goals, have a plan, and not see you for 6 weeks or 2 months. It's very individual depending on why you're there and what your needs are. We also do offer some group coaching because we know that although everybody is unique, there are some common issues that people with cancer experience. So we do have a bereavement support group, a caregiver support group. We also have a coping with cancer group and a work and survivorship group for people who are trying to figure out how to get back to work. We also run a CLIMB program, and that's actually for children who have a family member who has cancer. So the child does not have cancer, but they're trying to deal with their parent or loved one that has cancer. We also offer some coaching workshops, and so the coping, group coaching ones are offered by our cancer coaches. The workshops are ones that have been developed by people from the outside that we felt would be really beneficial and have been proven to be very helpful. So we have a positive thinking program. We have nutrition programs. We have an exercise program to try and get physical activity going. We run a meditation course. So there's all different courses that might meet your needs. And we have developed our nutrition coaching program, which is called Grounded, and we have a wonderful nutrition coach that really provides wonderful nutrition coaching, very holistic, that for people who really have special nutrition needs or want to make significant nutrition changes, she would be the one to see. We also offer here at our center healing therapies such as Reiki, and we have an infrared sauna. Some of the group programs, there is a cost for those, but the individual coaching, there is not a cost for that. And again, how it all starts is that everybody registers for coaching, and you always start with that one-on-one meeting with your cancer coach to see what your needs are and to develop a plan together. And from there, some of these group programs might be something that you decide might be helpful for you. We also have our center some other groups that meet there. Again, we are a hub for different things, but we do have on Wednesdays, there's a group just called, they are formerly clients, but from our Coping with Cancer group, but it's a peer support drop-in group. So anyone is welcome to join that and come in and meet with those, that group. So it's a drop-in group every Wednesday, and it's run by former clients. We also have on Monday evenings, there's a group, they just really wanted the focus to be more social fun. So it is also a drop-in group and a chance to connect with other survivors, but they really focus on playing board games, like more of a social piece with that one. That's what they wanted to do. We offer coaching. I mean, our team is fluent in French and English, but we offer coaching in pretty much most languages. We bring in a cultural interpreter for languages that the coaches don't speak at no charge to the client. Okay, next one. As I mentioned earlier, we have expanded, and we're very excited about this. So you'll see the slide on the bottom is our Maple Self Center, and hopefully some of you have seen it at the corner of Alta Vista and Innis. But we've expanded, so I go once a week to Canada, and the uptake in that site has been really wonderful. Beyond Yoga Studios gives us office space for every Friday so that we can offer cancer coaching there. We have a coach going also to the Vanier Community Centre, and we have a coach going all the way east to Rockland. And the future will offer more expansion, because we know that people who are experiencing cancer are dealing with issues like fatigue, transportation issues, all of that, so it's more helpful if we can get closer to their home. Okay, next. So if cancer coaching is something that you think might be of value to you, to your family members, there's a table at the back with lots of pamphlets, but you go to our website to register, or you just call. What we do is bring you in. If you're coming to the main site, you'd come in for what we call our weekly orientation center, and it's just a chance to tour the center, find out more about coaching, and get yourself ready for your first, because we want you to make the most of those 5 hours. And then we'll set up your appointment with your cancer coach. And we have a pretty good turnaround time for cancer coaching. That's one of our goals, is because we know when people are in need or in distress, it's helpful to see someone fairly quickly. So far our targets, we've been able to see someone. When we have your registration, you'll hear from us within 2 business days. So we've been able to meet that so far, and usually we can set you up for the next week, depending on your schedule and your treatments and all of that. So you'll meet with your coach for an initial coaching, and it may be that that's what you'll do, is just one-on-one coaching. It may be that you'll explore some of the other group coaching. Okay, next slide. So are you ready for cancer coaching? The question to ask yourself, and you don't have to answer yes to all of these questions, but if you have questions about your cancer treatment, your treatment options or side effects, if you feel ready to make a change and need help creating a personalized plan to do that, have you begun to take action to address some of the barriers you're facing, doing the things you need to do to have better cancer outcomes? And do you want to work on a goal with somebody else? Did you want to work collaboratively with someone? And or are you facing a new challenge or a transition, and you're seeking help with decision making? Or wanting to explore different strategies and options? If you can answer yes to any of those questions, we'd be more than happy to see you for cancer coaching. Next slide. And I think that's it for me. So now I'm very honored to invite Kip up to share his experience as a prostate cancer survivor.
Good afternoon, everyone. I am not a professional speaker. I have no slides, and I'm just going to read what I have here. I'm kind of nervous. So as Patty said, my name is Kip, and I was diagnosed with cancer in 2016, January 2016, my New Year's present. And in May of that year, I had a radical prostatectomy. I am now 46. I turn 47 next month, and it was kind of a shock at my age, actually, my Gleason grade was 7, so it's pretty aggressive, actually. And I did get a PSA, so listen to the experts. Actually, they do know what they're talking about. Okay, so some of you may know what it's like to have undergone treatment. Our medical systems are apparently one of the better ones in the world, but I must say that at times it may cure the disease. And my surgeon, he was perfect, actually. He was none of these guys here. He was perfect, excellent, but he left a lot to be desired, as far as I'm concerned, actually. Doctors are great. They're experts in what they do. You should listen to them. And they do their job, do it very well. No cancer, and sure enough, I haven't been good so far for the past year, but that left me a lot to be desired. So, as many of you know how to take a computer out, how do I deal with this? Everybody knows how to Google. So you type in anything in the internet, and it'll give you an answer. Anything. And some answers I got for prostate cancer and how to deal with it actually were crap, absolute crap. And some seem to make sense, and some of them are best left alone. So I found answers to prostate cancer, like everything from which diapers are best, which pads are best, which diet someone found to cure cancer, and that does not exist. So if somebody says, I found a diet to cure cancer, I will say chances are you're reading something that's not quite right. Listen to the experts. Maybe every week, this morning and now, we found out that cancer is individual. So maybe for some people, they were cured. They ate some diet. Maybe it was a bicarbonate soda and molasses. and they were cured, but I'll stay away from that. So for myself, actually, my big challenges were stress and erectile dysfunction. And it's still a challenge now. I've always dealt in some sort of self-improvement, and I exercise, I cut down on sugar, I tried everything I could with erectile dysfunction. I also spoke to my doctor, so I'll find some new drug. It's like, Muse, like, okay, Muse, and he looks at me, it's like, and he kind of looks at me, oh yes, here's a prescription. Gave that a try, that did not work. Viagra, oh yeah, I tried that, and that did not work. For myself, everybody's individual, Cialis and Trimix, those were the things that worked for me. Ask your doctor, there's lots of things out there, maybe it'll work for you, maybe it won't. The problem though is when you combine those things, actually, you could also have problems, so keep on speaking to the doctor, keep on speaking to the experts. So cancer coaching, it's helped me gain a bit of perspective, and after, it's been about 3 sessions, you know, things are still not back to normal, but what cancer coaching helped me with is actually talking to my spouse. So I see there's some ladies here, and I applaud you. Actually, mine, she was busy. It happens. But just being support, actually, that is much appreciated. That is, I think guys, actually, you should thank your wives, actually, because they put up with a lot. And they do. And you should applaud them and communicate with them. It's a hard conversation. Cancer coaching helped me with bringing up a hard conversation, like things are just not the way they used to be, and they may never be. And I can tell you the exact day when I had sex, but I won't get into those details. So, when I was again able to have sex. So the program, as Patty said, actually I met Patty every few weeks, and in those sessions we discussed what I wanted to do with my condition after surgery and what I could do in the meantime. At the end of each session, a document was left on the site. It was actually encrypted, so I could download it and look at it. And in that document, there were notes of what we discussed and what I needed to do to become or get close to becoming, at least feeling whole again. So counseling gave me tools, actions, things to consider, especially with my primary relationship. Those were my challenges, the sexual dysfunction and the stress. So yes, it's a nice little column. It's like, this is what we talked about. This is who is responsible. It is most likely you. It's always been me. These are the things I am responsible to do. And maybe some strategies. This is what you will try. This is what you try. And if it's successful, next time I saw Patty, great. If it wasn't successful, let's try something else. So, yes, I emphasize relationships. Good relationships always keep us happier and healthier, and apparently you will live longer. According to some longitudinal study, actually, if you have good relationships, your chances of survival actually increase by a good amount, actually. So for guys, I know guys tend to be like tough. I could tough this out. I could do it all by myself, and I tend to consider myself, yes, I'm strong. I could do this, actually. But just relationships, those are the things that keep you going. So yeah, prostate. Everybody should know by now that prostate issues have a large impact on your sex life. And for me, it was devastating. Actually, communicating with my spouse was pretty critical. And for myself, actually, this is the first public forum. Actually, at my work, I am lucky. Actually, I was able to take some time off. At my work, actually, I think I told maybe 5 people. On Facebook, actually, I think I told 5 people. So this is actually, I consider this a safe environment for myself to actually share my story. All right, and among yourselves, actually, and guys, actually, maybe there's no need for you to be like me and to share it to a whole crowd, but you can share maybe one-on-one with somebody else. Just communicating with somebody else actually gives you some perspective. Actually, have you tried, some questions? Cancer coaching helped me with that. Have you tried this? Okay, what about this? What about that? Okay, that sounds like a good idea. Why don't you try it? How did it work? And then kind of feedback. Okay, this is working well. And there's no miracle, and everybody's individual. You're kind of the own expert about yourself, but also listen to the experts and to the ones who have come before you. Those are critical ones. So one thing about cancer coaching is that you get to take control. And that sense of control is like, it's not the doctor say, okay, be here, be there, or you go on the internet, take this drug, that drug, and oh yes, you're so, you're saved. It doesn't work like that. But it's a sense of, okay, I'll try this, and if it doesn't work, I'll try again. I'll try something else. So I just want to conclude, not exactly an upbeat note for some people, but earlier this week I had a friend who had been battling liver cancer for about 6 months, and he died. And prior to his death, he had communicated with everyone on Facebook of his decision not to continue with chemotherapy, as it would have prolonged his life at a cost of quality. He made a video saying his final goodbyes long before his death, since he was wearing a striped shirt the wrong way, and he had ridiculous pink shoes. But he was happy. He was a little bit sad that he was going to be gone. So for him, actually, he refused to have any more treatment. So did he make the right choice? Actually, no one could decide that but yourself. So he made choices, and he took action based on what was important to him. And that's the thing about cancer coaching. It was, for Patty to allude to some people, they have different choices. No, should I take surgery, or should I have, what's the other one? Radiation. It's like, these are different choices. Should I do this, or should I do that? But sometimes in the end, actually, you're the one who has to make that choice. And my friend decided, okay, I have liver cancer at this stage. I could do more. He did chemotherapy, and he talked about all the wonders of morphine and pot, but on Facebook. But then after a while, it's like, nope, this is not going to work for me. So he lived out his last days, actually doing what he wanted. He was always really tired, and then he died. But the thing is, actually, the choice is yours. The choice is yours. What therapy or what things you could choose to do. Cancer coaching helps you. They don't tell you do this, but out of all the choices you have a myriad of choices that kind of help you, okay, this is important to me. And that's what I like to emphasize about cancer coaching. Thank you very much.
At Prostate Cancer Network Ottawa, we've always been aware of the Ontario Regional Cancer Foundation and their work, but in latter years we have forged I think a stronger relationship, and Kip is even though I just met Kip for the first time, but we've referred a number of people to, and I have personally referred people to, and it's just great. It's just phenomenal when you hear back from the client or from your colleagues saying, "Thank God, I needed to talk to somebody," and the cancer coaching has been very helpful. So I'm delighted that both of you from both the Ottawa Hospital and the Foundation have come along. And Kip, thanks for having the courage to tell your story. We really appreciate it. We've got a few minutes for questions. So anybody have a question for any of our guests and panelists? Where are we? Over here, David, please.
I'm a good singer, but I won't do karaoke. I've actually been to your center. My wife went through the cancer treatment thing a few years ago, and I won't say any more about that. But I'm curious what you're teaching people there. What are you teaching about coffee, soda pop, and the junk food that so much of us consume?
Who wants to take that? Yep. You can come here. Sure.
Okay, yeah.
So I'm assuming you're addressing that to the foundation, our programs, or were you talking to the nutritionist at the hospital? I'm assuming you're addressing. I'll address it for our center for sure. So we have a wonderful nutrition program. The information we give out is evidence-based or evidence-informed. As much as nutrition's a difficult subject because the evidence isn't as clear as it is maybe for some other things. Like, for example, there's so much evidence about the role of exercise, and it's very clear how that helps with a cancer diagnosis. There's emerging evidence on meditation and how that works. With nutrition, it's not quite as clear, the evidence, and it changes frequently. But there is strong guidelines. There's guidelines from the World Health Organization. There are guidelines from the Dietitians of Canada. There are guidelines from different cancer networks. And so the information we give out is based on those guidelines, which is based on the best evidence available. So our nutrition coach is not sort of giving out information that's way out there or really far out or anything, but we're certainly addressing things. What we usually, her advice and what I share with clients, because I also do some nutrition coaching, is you know, a lot of plant-based, but you don't need to be entirely plant-based, but the more plant-based you have, things we know for sure that decreasing red meat and processed meats is a good thing to do. We know that decreasing alcohol assumption. So we're teaching the basics, but then we're also giving a wealth of information on how to do that, what recipes you can have that will help you eat more fruits and vegetables, eat more of the healthy things that are going to help you. Does that answer your question? No.
Another question? Okay. Well, thank you very much, folks. Delightful. Thank you very much.